Tea and Tales, where vets share stories, tips, and a cup of tea. I'm your host, Megan Taylor, and with me today is Dr. Nour. Welcome.
Thank you.
Today we're diving into a subject that's not spoken enough about, but is so important to our pets. September is Pet Pain Awareness Month. So if Dr. Nour, you can give us a little bit information about why this topic is so important to you and a little bit about your background too.
So I've been a veterinarian for almost 10 years now. Through that time, I completed a general practitioner certificate in oncology. Oncology cases are deeply emotional.
Right.
They combine science with medicine and the emotional bond between the owner and the pet. But the center of these stories was the pain.
Yeah, I was going to say you can't really speak about oncology without having a large topic about that being about pain. Yeah.
Exactly. It's so challenging. And the reason why made me more aware, and I like to make people aware about the pain, is how their life it changes if the pain is really under control and if it's really managed.
Yeah, you'd see such a difference in them. An animal in pain to an animal where the pain is managed, there's a big difference for them.
A huge difference.
So you kind of gotten into it already, but why is pain such a central welfare issue in veterinary medicine?
It's a core welfare because it touches every aspect of the animal's life. From the way they eat, they move, their quality of life, their interaction with their family, with their owners. It makes a huge difference when they are in pain or when they are not in pain.
Right. And what happens if people as owners, they underestimate or kind of miss the pain signals in pets? Or even if we go one step before that, what are the main pain signals in pets?
The problem if they underestimate or it goes unrecognized, of course it will cause further issues and it can turn into a chronic pain that is more difficult to be treated later. So if we ignore maybe subtle signs of pain, then later in future we will be dealing with more sophisticated or more complicated type of pain, which is difficult to control.
And if you could just let people know, what are those kind of subtle signs of pain before it's a full-blown, like he's limping, he's not walking, he's crying? What are those kind of subtle signs people can look out for to know?
It can be sometimes just behavioral changes. Sometimes the client will call saying that my pet is not himself. So
they can't really put a finger on it.
They cannot exactly tell what's the problem, but they can say he's not himself. Maybe he's hiding more. Maybe they are over-grooming themselves. Sometimes they just neglect the grooming themselves. So it's not only about not eating or sleeping more sometimes, or even they are less interactive with their family.
And do you see a big difference between the pain symptoms in cats and dogs?
Usually different creatures show pain in a different way. Like for dogs, for example, they whine, they growl. With cats, they are more silent. It's a bit different.
Yeah. And can you just also let us know, how does the pain management affect the bond between owners and their animals?
As I said, because the pain makes them less interactive. So they won't be behaving. They won't be showing their natural behavior with their owners. Sometimes even because the pain can be severe, they can be aggressive. So of course it will change the bond between the owner and the pet if the owners are not aware that this can be a sign of pain.
Well, that's why I think it's so important as well for people, if they notice kind of such extreme change of symptoms in their pets, that aggression starts. It's so important to first do the vet check.
Exactly.
Like some people go straight to behaviorist, or they kind of think, oh, it's a training thing or whatever.
True.
But unless you rule out this kind of pain,
exactly,
it's got to be the
a
first
sign
step
of pain.
Yeah. So another question, people, like you kind of already said already, the cats hide the pain so well, and so do rabbits, and so do kind of other small animals. Why? Why do they hide it so much better than other animals?
It's usually because of their survival instinct.
Okay.
Mainly in rabbits and cats. They say because if they show their weakness, they are a target in the wild. So that's why they evolved to keep their weakness hidden or to mask the signs of pain, so they are not a target to their predators.
Yeah, it's very evolutionary. Yeah.
So that's why it's a little bit different between cats, rabbits, and dogs, how they express their pain.
And how does it start to kind of impact you as a vet when owners start to make these kind of statements like he's not old, he's just in, or he's not in pain.
Yeah, he's not pain, he's just old. Yeah,
exactly.
True. We hear it a lot usually that it's just a sign of age, but it's not true. Like when you see them sleeping more, especially cats, or dogs moving less, it can be a sign of pain as well. It's not only aging.
Yeah.
So they can be having arthritis that they won't show specifically by limping or by something specific, but mainly by getting less active. They are reluctant to go up the stairs. They are not jumping on the sofa or on the bed as they used to do. So people will think that they are just getting old. But no, it can be a sign of pain. So it has to be recognized.
And it's just that reminder that the age itself is not a disease.
Yeah.
Like the slowing down is symptoms of a problem. And if there's a problem, there's oftentimes things we can do to fix it.
Yeah, exactly. I remember one of my seniors that used to say it, to tell me while I was taking care of hospital patients. And now I say it to the nurses as well. Like when you carry an old animal or geriatric animal, just imagine that you're carrying your grandma, because you can imagine how painful is it with their muscles, their joints. You feel like your whole body is aching. So it is pain. It's of course it is pain that comes with aging, because there are some pathologies that come with aging. But we cannot ignore it just saying that they are getting old. There is pain somewhere.
And if we could get a bit more into the kind of pathologies that you commonly see when they're aging.
Like arthritis, for example, it's very common, and we have to recognize it and we have to deal with it.
And can you let people know a little bit more about arthritis, like the pain management that you could offer, like the options available to people?
There are many options, of course, to be used. Depends on the case. There are some options like non-steroidal anti-inflammatories. There are some injections that control the pain pathway. So there are many options, but the most important thing is to be able to recognize it and to detect it.
Detect it. And when we're speaking of arthritis and pain, you have to think as well, like how much important is prevention. Like there's
prevention.
Not, we're going to manage the symptoms, but if we can start managing these like 2-3 years, ahead of time.
Exactly. This is why I said that, because acute pain can turn into a chronic pain later if we just neglect it and we don't treat it.
Right. And then can you let us know, for people who want to know, spotting the signs of pains in pets, what's the most reliable behavioral signs of pain?
Of course, behavioral change. You will see that your pet is not acting as he or she used to be. You will see that they are eating less. Their appetite can change. They are reluctant to move sometimes, sleeping more, maybe limping, or they put weight on some limbs more than the others. Sometimes it can be aggression, as I said, so like a total behavioral change because of that. And
what about more physical signs like posture, vocalization, or even changes in breathing?
Exactly. With the posture, you can see that sometimes they are hunched because of the pain. They can be vocalizing, like whining or growling or hissing, like in cats. And the posture, sorry, what did you say?
And the change in breathing.
Change in breathing. Yeah, this is very important because they can be panting, like breathing very quickly. The breathing can be shallow. And sometimes we can see that it's arrhythmic, like there is no proper rhythm while they are breathing. So it can be all indications of pain.
Okay. And as a vet, probably you use them, but would recommend for owners? Like, how can you explain pain scales like the Glasgow or the Rabbit Grimace scale? Like, how are they often used in practice?
Actually, these are very important tools in veterinary medicine, and of course, it helps guide us to scale pain. So, like for the Glasgow for dogs, for example, we mainly focus, as you said, on the posture, on vocalization, on the activity. And in rabbits, mainly it helps us to focus on mainly the facial expressions. So that's why they act differently. Rabbits act different than dogs. You can see you have to focus on their facial expressions, like their eye movement. Sometimes their nostrils. You can see this cute U shape in the rabbit's nostril that is disappearing. It's turning into a V shape, for example.
Wow,
This is one of the signs of pain. When they flatten their ears to the back as well, this is a sign of pain. You can see that their face is sunken, it's not round anymore. So these scales help us, of course, to detect the pain. And the important thing, it's like a prognostic method as well. So it helps us to observe, to see if the treatment is effective and to change or to alter the pain management accordingly.
Right. It's so interesting that you can just see these really subtle signs even on their face, and this is how they're showing you always.
Yeah, you have to understand that each creature is differently, shows the pain in a different way.
Yeah, it's so important, and each animal is very individual as well.
True. Yeah.
So if you can let us know a little bit about how does untreated pain affect healing and the immune function? Like you spoke earlier about kind of how when it turns into a chronic pain.
True. Actually, the pain can reduce the healing process of the body.
Wow. Okay.
And of course, with the stress, you lower the immune system, the immunity of the body. So it has a major effect on the.
It's interesting actually, because you see a lot of people with pets like around 10 or so, and then they've been quite healthy up until then, and then they'll have one maybe sickness or one illness, and then they're like, and then they were just sick the whole time after that. Like a lot of people kind of say, and it just kind of started to snowball after that. And
exactly.
That could be because of the stress.
Yeah, exactly. And sometimes it can happen like as simple as just one hospital visit. Like, for example, presenting for a very simple surgery. But if we are not aware that we have to control the pain before the painful stimuli, then this can put the animal in a chronic stress and a chronic pain. So we have to be aware how to manage the pain before even it happens, just to expect that something painful might happen, so we react before.
Okay, that was kind of my next question. Can short-term pain really develop into chronic or neuropathic pain?
Yes.
Can you explain to people as well, like neuropathic pain?
Yeah, actually, because if an acute pain or a pain that gets unrecognized and not treated, and we don't treat it, it can develop into a chronic pain because we call it sensitization of the nervous system.
Okay.
So it gets overreacted to all the pain stimuli. So then it is really difficult to control the pain if our nervous system is overreacted. So this is how an acute pain can turn into a chronic pain or to a neuropathic pain.
And as a vet, is there a different way you would treat each one, for instance?
Yeah, of course, there are different methods, different protocols.
And what are the welfare concerns if the pain is left unmanaged?
This is unfair, of course. No one wants to be in pain, and no one accepts even an animal or a living being to be in pain unnecessarily, because it's not like something that you cannot treat or you cannot deal with. No, it's something that can be treatable. You can deal with it. You can manage it. So I think it's not fair to let them suffer.
You encounter that a lot as a vet. People have, I notice it a lot as a physio. People have like an aversion to painkillers sometimes. Like, oh, I don't want to put them on pain. You know, like they're a bit resistant to it. And I don't know if it's they don't feel that their pet is in pain, or they don't feel it's severe enough to warrant it, or they maybe an unknown is like the fear of the unknown. But I hear that a lot. Like, oh no, I don't want to put them on painkillers already.
It happens. Yeah, of course it happens.
How do you kind of deal with owners who have this view?
It is difficult because sometimes as well they don't. It's not their fault in some cases that they because, as I said, animals can really they can master hiding their pain. So sometimes the owners want to be able to detect it. So they are not aware that their animals are in pain, or they cannot, they don't agree with you that these are signs of pain because, oh, come on, as we said before, it's like just a sign of aging or just being more attached or more clingy.
Or the one that drives me crazy is like this Labrador, like who has arthritis, for instance, and it's like, no, he's not in pain. He was running around all day, and then it's like, yeah, now he's really limping, and you're like, you cannot trust that he will just never run again. Of course, he'll have adrenaline. They will run around like crazy, and then the next day they're really sore. But just because they, the animal instinct takes over and they want to play, that doesn't mean that there's not still kind of underlying pain there.
Or maybe he's just lying on the floor and he's just in pain when he stands up. But can you imagine yourself having arthritis pain, sleeping all the night, and then you wake up with this sore joints and pain everywhere. So you have to imagine the same. They experience the pain as we do, and this is the tricky part. It's a really
strange concept that people think they don't, like this, they don't experience pain like us, or there's kind of an awareness, like they feel it differently, especially like. The animal could be limping, and they're like, but they're not in pain though. And I'm like, have you ever limped and you're not in pain? Like, of course we're limping. It's not for why else will we do it?
I'm not just happy to limp. Or it's a myth. It's a myth that many people don't understand, that they feel the pain the same as we do.
Yeah. Okay, so if we can get in a bit to treating pain as a vet, what does preemptive analgesia mean, and why is it so important?
Preemptive is dealing with the pain before it happens.
Okay.
As I mentioned before, like for a surgery, animal presenting for a surgery, which is a tiny procedure like a spay or a neuter or something simple, you have to give them pain medication before the nervous system starts firing up. Like then at this point, you won't be able to manage the pain because the nervous system is already like overstimulated. So this is the point of doing or managing the pain before it happens, because you are expecting that the surgery will be painful. So why I don't give pain medication before I start the procedure?
And is that common practice in most vet clinics, or
it should be, because ethically it should be. And of course, as I said before, it will affect the healing process of the patient after the procedure, because if they are in pain and their pain is not controlled, the healing process is all disrupted.
It's all related, right? So what do vets mean by multimodal analgesia in everyday terms, please?
It's like a cocktail of analgesics. It can be non-steroidal anti-inflammatories, plus opioids, for example. So it's mainly combining different analgesics. Of course, this will give you the opportunity to give a very little of each, mainly because they can work synergistically and they can control the pain in a better way. So it's mainly like a cocktail of drugs, but of course we have to be aware and we have to be knowledgeable about the mode of action of each one of them, so we don't combine things that should not be together.
Of course. And how about non-drug methods like physiotherapy, weight management, or acupuncture? Do you feel those fit into addressing pain, or do you use them often?
Me personally, I like it. I like physiotherapy and hydrotherapy. It reduces the stress on the joints, the stiffness. It strengthens the muscles as well. And acupuncture is a great way to deal with pain, because it activates the natural body pain pathway or mechanism.
Right.
So it's really helpful. And this is for people, because you asked me before that some people will say, no, I don't want to give any painkillers to my pet. But there are some alternatives, like
we don't need to do nothing.
Acupuncture, these are all alternatives.
As a physiotherapist myself, I can also we see a lot actually that sometimes it's kind of a last resort, which is so strange, because it's like maybe this should be the first resort, or like kind of one of the first options.
It shouldn't be the last resort.
Especially with arthritis again, when the dog is like really unable to get up, they're like, maybe we try some physio. And I'm like, had we started this 2-3 years ago to maintain the muscle mass, to stay on top of this, it's going to be much more effective than we're already kind of at the end. And this is maybe when you can be a bit more heavy with the painkillers and this
And
is the time now.
Yeah,
But
yeah, exactly.
yeah.
This makes your job more challenging because they arrive to physio after everything have been tried and after it's like almost too late.
And humans,
But,
we kind of do the opposite. Like, okay, before I give you all these pain meds,
Yeah.
go to the physio, try to lose some weight, or whatever the
True.
option is. We start a bit more conservatively and then elevate. But I find in veterinary medicine,
it's the other way around.
it's the other way around. We're like, oh, you can try that at the
I
end.
think maybe because they decide to choose the easiest or the easier way.
Yeah.
Maybe.
Or maybe it's a new
Yeah.
concept as well, and it's not.
Possibly.
Yeah. How often should vets reassess pain during treatment? Or how often do you find yourself doing that?
Of course, it depends on the case. If it's a hospitalized patient, you have to be doing it many times, several times during the day. It has to be frequent, of course. And this helps you to do some changes. If you see that they are still in pain, then you have to adjust, increase the pain medication, or use something else. Or even if they are getting better, then you start tapering and start reducing the pain medication. So, it has to be done frequently, of course.
And for the kind of more chronic pain patients, had you have it's obviously case by case, but how often would you usually recommend them to be coming back in? Like you know they have a chronic problem. Do I need to come in every month to reassess, or is it?
Yeah, with the chronic patients, regular visits to the clinic are really important.
Right. So for owners at home, obviously they want to know what's their role in all of this. So what's one thing every pet owner should look for that might indicate pain?
I think they are all aware about the major changes, like they are not eating at all or they are not moving. But there are, as I said, there are subtle changes that they don't recognize sometimes. As we said, like sleeping more, being less interactive. Sometimes their appetite can just change. They are still eating, but their appetite can change.
Like got a little bit picky, maybe. Yeah.
Yeah. Sometimes, as I said, they overgroom themselves, and sometimes they overgroom a specific area where the pain, like it's the source of the pain.
And you see that a lot. People thinking they have some kind of skin problem or some kind of allergies, and it's like, no, he's got a. They see them licking, and they understand that it's
it can be a joint,
problem,
for example.
But it's a joint. Yeah, exactly.
Many signs can be difficult to recognize, but the awareness, like we have to be aware and we have to be knowledgeable about these tiny symptoms that we may think it's just something normal, but in reality it's not.
Or another one I see a lot of owners kind of only notice in hindsight, like once the animals progress to a point, you ask, like, when did it start? They'll be like, oh, in hindsight, actually, they were stopping a lot during the walks. Like, they sat down more frequently, and at the time, they don't notice it. They kind of think they're just being lazy.
This is an early sign of pain.
But it's not really that common or normal in a healthy dog to keep sitting during the walk. It probably means you're overexerting them or kind of flaring something up a lot of the time.
True.
All right, you already kind of addressed the subtle changes, but how do you explain to pet owners that pains absolutely do feel pain, just a little bit differently to us? Like we kind of mentioned already, these people have the concept that they're not feelings of pain.
This is difficult, but usually you have to make them aware as much as possible that they really do feel pain, and these changes are proven to be a sign of pain. They have to understand that. And sometimes I've seen it many times, they just ignore that, no, this is not a sign, like they are in denial. But we reach a stage where it confirms that what we've said in the beginning is really a sign of pain. And now we reach a stage where we have a chronic pain. And it's really difficult to deal with it. And everyone gets frustrated. They get frustrated, we get frustrated, the patient gets frustrated, because if we dealt with it from the beginning, we wouldn't have reached this stage where it's really difficult to control. So, prevention is the key.
Yeah.
As we always say.
Exactly. And to be honest, we can't really get into pain management and, as you kind of said, the end result of pain and chronic pain without discussing euthanasia. It's a topic that no one wants to speak about, but it's hard not to mention it and kind of discuss with owners as well when there's a pain management that's not under control anymore. How do you help owners assess the quality of pain in their pet's life?
It's really difficult, as I said, to make them aware about all these symptoms and signs, and to make them aware that there is a quality of life that is more important. And of course, they have to understand when the pain outweighs the comfort, then it's time for the compassionate conversation.
Okay. And I think it's such a hard thing for owners to always get, though. Is there a way, like, maybe the owner's not agreeing with you, like that they don't think the pain is out of control or that it's time yet? Do you have a way of kind of like helping owners to realize?
Yeah, I try my best, and many times what happens, what I realize during this period of time, especially dealing with oncology cases that sometimes can be hopeless. You can reach a stage where there's nothing I can do anymore. But I don't want your pet to suffer, because this is not animal welfare. Many times the client will ask me, like, if it was your dog, what will you do? So I think sometimes putting yourself in their shoes makes them understand better that no, we have to stop. It's time to stop. And I think building a good relationship with a client where he trusts you and he trusts your decision, it's much easier than just a random vet visit and you advise them to...
Yeah, it's the first time you've seen their pet. And I'd say in oncology, obviously you're seeing them very frequently.
Exactly.
It's probably the trust is built a lot more. Are there signs that you look for that suggest an animal is suffering too much? A lot of people kind of wait till they're not eating. Would you recommend, like, a lot of people are like, if he's still eating, then no need, but sometimes it's also the other side of it. You don't need to wait till the pain is, this. You don't have to end on their worst day. There's kind of a saying. You can also help them when they're still feeling okay and they're not at their absolute worst. It's necessary to put them to that point.
Yeah, exactly. Because it's not only about eating. They can still eating, but they are not moving around. They are not interacting with their surroundings. They are getting more reactive, aggressive. It will affect their cognitive function even. So it's not only about eating there are many other major signs that we see that makes us proceed with a decision that we have to.
You've kind of gotten into it, but how big a role does pain play in the discussion to euthanize with owners?
Can you repeat that?
Yeah. How big a role does pain play in the decision to discuss euthanasia with owners?
It's a major factor in the decision of euthanasia, because pain can affect the quality of life. And the most important factor in judging if we have to euthanize an animal or not is their quality of life. So, it's a very major factor in the decision. Key players. Yeah.
And what's the hardest part about having that conversation with owners when pain management is no longer enough?
Actually, the hardest part is the emotional bond between the animal and the owner. So it's really sometimes very difficult to let them understand that this is the end. Like, we cannot do anything more. So I think to understand this attachment and these emotions is very difficult. So you have to know how to really deal with these emotions. I think, this is the most important or this is the most difficult part in taking a decision of euthanasia or ending a life, because of this strong emotional bond.
It's interesting. A lot of people always say, like, I can never be a vet. I couldn't do the euthanasia. It must be the hardest part. But a lot of the time, you kind of see it's maybe not even the hardest part. The hardest part is maybe when the owner doesn't want to euthanize and you know that you're kind of prolonging a lot of suffering and you're not going to be able to get onto the same page of, like, it's probably in their best interest.
Believe me, it's very challenging. Like, it doesn't go easily. Sometimes it's really challenging, and you have to try different methods, different way of communications. You have to keep showing them and educating them that these are signs of pain. This is not animal welfare. This is not equality of life. It's very challenging. It's not easy.
Well, yeah, you've kind of gotten into it, but how do you explain the difference between prolonging life and prolonging suffering in a way that helps owners understand the difference?
It's mainly like simply. It's mainly like explaining quality time or just an empty time. So prolonging their life, and there is no quality in this life. There is no point of it.
Yeah, they kind of say you have to be able to assess, are they having more good days or more bad days? And it's kind of that scale of
exactly.
once we're kind of really, there's one good day and 3 weeks
or sometimes if I ask them, do you want to spend their last days at the hospital without you being around, or do you want them to spend some good time with you and then we let them pass peacefully? It's really tricky. It's really difficult to let them understand, but mainly to compare, like, is it you want a quality time or you just want to prolong
the time,
an empty time?
Yeah. So we'll try to end on a slightly lighter note.
Yeah.
If you could bust one myth about animal pain, what would it be? Just to end it right now and people stop believing this.
That they don't feel pain like us. So
Yeah.
This is a myth.
Yeah. Let's end that one, everyone. They do.
True.
And what's one practical takeaway you'd like every pet owner to leave today knowing?
I want them to trust their observations, even if they are
that's a nice
tiny
one.
things.
Yeah. You know your pet best.
Yeah,
actually.
exactly.
Yeah.
They know how their pet behaves, reacts. So if there is any tiny change or subtle change, then you have to trust your observation. You have to contact your vet. Don't just say I'm overreacting or it's something silly. It may be something major. So they have to trust their observation.
Trust your gut. That's a nice one. Thank you, Dr. Nour, so much for speaking with us. It's such an important topic. So thank you for taking the time to speak with us today.
It's my pleasure. Thank you so much.
And for everyone listening, please let us know in the comments any questions you have or any topics you'd love for us to explore more. And join us next week for another episode of Tea and Tales.
Thank you.
Alex, only want to know.
It was so good. Cheerfulness. And I was like about to. And Megan like just dropping.
Cheerfulness.
I was like a cliffhanger.
Is it good?
Yeah.